surgery. Did you all miss me? That's right, I was gone for what, 2 weeks? 2 weeks. So we just made it back all the way from Japan and the Philippines. It was an awesome trip. It was a long way home. But yes, we are back. And today we're just going to kick it old school here today. So what we're going to do is just going to answer a whole bunch of questions. So as you know, I'm a double board certified plastic surgeon. I am Princeton educated, Duke trained, and I've done over probably now 7,000 procedures under my belt, so you know you're getting good information here. We are based in Miami, Pure Plastic Surgery, and we take patients from all over the US and international as well. So, all right, I am happy to answer any plastic surgery question that you might have from head to toe, any procedure. We can talk about pre-op, surgery, post-op, complications, or anything in between. All right.
And Japan?
What's that?
And something about Japan?
And something about Japan? Hey, happy to answer any questions about Japan as well. By the way, awesome country. Really loved it out there. Everything just works. The train is absolutely on time. The bullet train was awesome. The city, extremely clean and beautiful. The people are so nice. And the food was delicious. So I certainly highly recommend it. All right, so you guys want to get into some questions? All right, let's shoot.
Any recovery tips after a BBL?
All right, so here we go. So BBL stands for Brazilian butt lift. That's right. And so what is that? It's a combination of liposuction, what we call liposculpture 360, and fat transfer to the buttock and hips. All right, and that's important to know that it's a combination of those two procedures, because then we're going to talk about the recovery. So you got to do things for recovery for the liposuction part of it and for the fat transfer part of it. All right, so for the liposuction part of it, what is extremely important? Number one, your massages. I am a big proponent of post-lipo lymphatic massage, and I recommend a minimum of 20 massages after surgery to truly optimize your results. And how are you going to separate them? Well, the first 7 are going to be daily. The next 7 are going to be every other day. And the last group of 6 or 7, if you're going to do 20 or 21 massages, is going to be weekly. All right? The next thing is hydration. Hydration is extremely important after this type of surgery. So you want to be drinking a gallon a day, which is 128 ounces. All right? Mostly water, but also something with electrolytes, such as Gatorade or Pedialyte. All right? And then compression. You have to wear a faja with foams, basically night and day for the first 6 weeks, and then 12 hours a day for an additional 6 weeks after that. Okay? And then what about the fat transfer part of it? Well, the key there is you cannot put pressure on it. So no pressure in the buttock or hips for the first 6 weeks. All right? Because we want to get as much of that fat that we transfer to survive. And then the other thing that's super important is what we call, quote unquote, feed the fat. So you want to feed the fat for the first 3 months, which means you want to increase the healthy fat in your diet, such as avocados, eggs, salmon, some red meat. But if you really need a couple extra calories, just go for that milkshake and ice cream, all right? And make sure you feed the fat for the first 3 months and don't lose absolutely any weight whatsoever in those first 3 months. That's pretty much recovery in a nutshell.
Do you go on top of the muscle or under on TikTok?
Of course, so that's a great question. And it is 2025, which means that every single surgeon in the world should be putting the fat on top of the muscle. We know now for a fact that it is dangerous to put the fat into or deep to the muscle. Okay, that is what has led to many what we call episodes of fat embolism and instant or sudden death. All right, so the fat should never be placed into or deep to the muscle. Doesn't matter what surgeon or what country, anywhere in the world, okay? And in addition to that, the next thing that you gotta ask is, well, how do you know you're over the muscle, right? Because technically, if you're just using the wand or the cannula to put the fat in, it's a blind procedure. Well, guess what? Now it doesn't have to be, because we use what's called ultrasound imaging or ultrasound guidance. And so with the use of the ultrasound, now you turn a blind procedure into one where you can actually see and you can make sure that you're putting the fat over the muscle. And I am one of the pioneers in ultrasound guided BBLs. I've been doing this since September of 2019, and I have now, significantly over 2,000 ultrasound guided BBLs under my belt, and I have never had any issues with a fat embolism because of that.
Are you board certified on TikTok too?
Yeah, I'm not only board certified, I am double board certified, all right? So what does that mean? It means I have 2 boards. I am boarded in general surgery, but more importantly, because this is what I do day in, day out, I am board certified in plastic surgery. And so when you're asking the question, are you board certified? Sure, that's important. But actually the real question is, what are you board certified in, right? Because you can have people that are board certified, for example, in OBGYN, and they're doing liposuction. And why it's legal to do that in the US, you can do it, but it wasn't what they really trained for, was it, right? And so that sometimes you can do an OBGYN residency, graduate from that, and then do what's called a cosmetic fellowship, and you're doing cosmetic surgery without being board certified in plastic surgery. So the important question is, or maybe 2 questions. First, are you board certified? What are you board certified in? Make sure that they are board certified by the American Board of Plastic Surgery.
Okay, Doc, do you receive Lipo 360 when getting a BBL?
Yes, so every BBL, so all BBLs, okay, so BBL will include Lipo 360 plus the fat transfer to hips and buttock. Okay, that is the definition essentially of a BBL. Now, can you add stuff to this? Certainly. So you can now start adding stuff to it, right? Say you want to add other areas, then you can add the chin, the arms, the inner thighs, but those are typically going to be an additional cost. These are what we call add-ons, all right? What else can you add on? Sometimes you can add on skin tightening procedures. That can be your J-plasma or body tight as well. Other things you can add on is definition. So you want to go high definition with ab etching. Well, that can be added on as well. So there's certain things you can add on to that, but your baseline BBL will include your Lipo 360 with the fat transfer to the buttock and hips.
This is a real trend right now, Doc.
Yeah.
I've been hearing lately that BBL stink, the BBL smell. Is this true? It's been very discouraging.
It is a total myth. It is not true whatsoever. I do not understand this trend. I don't know why people are talking about it all over TikTok, all over Instagram. It's basically, I don't know. I think it's actually, it was started by guys, right? It was started by men with this false BS about BBL smell. Whatever. Bottom line is, it's not true. It's totally fake. Is there a smell when you first have surgery because you're sweating in your faja? Sure, that has nothing to do with a quote-unquote BBL smell, right? It has to do with someone recovering for surgery. So no, there is no such thing as a BBL smell. It is false. It's just whatever, social media hype.
Thank you, Dr. Earle. Next question. Are there long-term effects on the rib remodeling like arthritis? Can it be done during lipo?
Okay, so could there be potentially some long-term effects or complications from rib remodeling? So any surgery, all surgeries have complications, right? Potentially. And I'm talking about anything, right? You can have complications from going to the dentist, right? The only way to have 0 complication rate is to not do the procedure, in the same way that the only way to have a 0% chance of crashing is to never drive your car, right? So specifically, what are the potential risks with rib remodeling? So one of them, the one that we worry about the most, is what's called a pneumothorax. That is, if there's a tear into the lining of the lung, well, that can then cause air to be trapped between the chest wall and the lung, which can then cause the lung to collapse, and that's called a pneumothorax. So that's something that is a potential risk, but unfortunately the risk of that is going to be very, very low when you do the rib remodeling surgery, which, remember, is not the same as rib removal, right? Rib removal surgery is a lot more aggressive. And that's what people were afraid of. That's not what we're talking about here today. This is 2025. We're talking about a much less invasive procedure, which is where you're just simply reshaping the rib. That's what rib remodeling is, okay? But one of the things that when you reshape the rib, you create a controlled fracture, and then you infracture that rib, and then you got to keep it in place so that it solidifies in its new position. And so how do you do that? Well, this is where the patient comes in. You have to wear a corset for 3 months straight, no breaks. Because if you don't do that, then you're right, then it can never solidify in its new position. And if it doesn't do that and it becomes kind of wavy like this, you have what's called a non-union, which can feel like an arthritis. It can feel like a chronic pain in the area, and you certainly don't want that. But it's all up to the patient at that point. You have to wear that corset 3 months straight, no breaks. You have to commit to that. Oh, second part of the question, can you do it with lipo? Yes, the answer is yes.
Doc, this is a recognition for our amazing team, especially Janet. She
Oh,
made, yeah.
All right, shout out to Janet.
Yeah, from Melly. She says, especially Janet, she made the whole experience amazing. Anesthesia team, nurses, and all the staff is so amazing at Pure.
Awesome, awesome. Well, thank you for that. And you know, that is so great to hear because we are extremely proud of our team. It is definitely not a one-man show here, or not even like a one-surgeon show. So it's not just about the surgeon, it's about the entire team here. Everyone you meet, all the way from like the first phone call you make to our post-op team, we are all here for you every single step of the way.
Doc, this patient said that she wants surgery, but scared because of healing, because it's a diabetic A1C.
Yeah, so that's a good question. So if you're a diabetic, are you a candidate for surgery? So the answer is yes, if your diabetes is under control. And how do we know that diabetes is under control? We check that. We check the A1C, which is a blood test, okay? And that blood test needs to be 6.5. The A1C needs to be 6.5 or below, okay? So the hemoglobin A1C needs to be 6.5 or below. If it is, then you are good to go. That means your diabetes is under control. Good job, and you're able to have surgery. And while your risk factors might be a little bit, maybe slightly higher than baseline, they're not so high that surgery shouldn't be done. However, if it is much higher than 6.5, then that means that your blood sugar levels are not necessarily under control, and therefore your risks go way up. And we're talking about risk, for example, like infection or wound breakdown, non-healing, things like that. And therefore, we should not do elective surgery until you're able to better control your blood sugars.
She's on 5.3.
There you go. So you are good. You're taking good care of yourself. You're going to continue that regimen, through basically before, during, and after surgery. And if you're able to do that, then yes, you're okay to have surgery.
Can you talk about the scars for tummy tuck?
Yeah, so the scars for tummy tuck are very, very important, right? So first of all, what I think looks better, like loose, overhanging, wrinkly skin, or a well done tummy tuck scar. I always vote for the well done tummy tuck scar. I think with that you can still put it on a bikini. You can put on like a low cut jean or whatnot, midriff, and you're gonna look fantastic. Okay. But what do I mean by a well done tummy tuck scar? There's a couple of factors in there. Number one, it's all about the belly button, right? You have to be able to create a nice, natural appearing belly button. So what are the types of belly buttons you don't want? You don't want those belly buttons that just look like a slit, or that a little tiny pinpoint that are way too small. Those are dead giveaways. And the other thing you don't want is a belly button where you kind of see the scar line on the outside, okay? Because that's gonna be more visible, and sometimes that can even become hypertrophic or cause a keloid, which is gonna be extremely visible. So the key is to create like a naturally kind of shaped belly button, which looks a little bit kind of like a diamond shape almost, with that scar tucked in as much as possible so that it's not so visible from the outside. And then the other part is like the lower scar, the lower, abdominal scar. You want to make that very, very low, okay? And you want to have it in what I like to call a nice, gentle curve or smiley face. because that's what's going to be easiest to hide in a swimsuit, even a small bikini. So you want to create that nice gentle curve. You definitely want to avoid the straight tummy tuck scars that go like this, because those are going to be impossible to hide in a bikini, and also it tends to give the patient a more boxy appearance. You don't want to do that, all right? So make sure you keep it in a nice gentle curve.
Okay, next question. We have a lot of questions here.
Oh boy, Instagram's on fire.
Yes, sir. I love your liposuction and body contour work. Do you do fat transfer to breast as well?
So I myself, I don't do fat transfer to the breast, but our other two surgeons here, Dr. Vidal and Dr. Wigger, they certainly do. So if you want to do that, we definitely have options for you. Why don't I do it personally? I mean, I just like the implant. I think the implants work a lot better. They create a lot nicer shape, and it's just a lot more versatile. When you do fat transfer to the breast, there's a lot of restraints. First of all, you can't really change the volume that much. Maybe you might be able to go up 1 cup size from like an A to a B or a B to a C. The most you can probably add is 200 to 300 cc's of fat in terms of volume. And the other thing is that it doesn't really alter the shape of the breast, right? It doesn't have that structure to be able to alter the shape. So you're gonna have pretty much a similar looking breast, just slightly larger. So I think the implant is a better option to augment the breast.
Okay. I heard liposuction damage the lymphatic system. Is it true? Do they heal with time?
Yeah, for the most part, it definitely heals with time, as long as the surgeon does their part and as long as the patient does their part. What does the surgeon have to do? The surgeon should not be overly aggressive, meaning that you always want to leave a little bit of fat underlying the skin. I like to leave approximately about 1 centimeter of fat underneath the skin, and that avoids issues with lymphatic drainage afterwards. So number one, do not be overly aggressive. Number two, though, from the patient's point of view, you have to commit to your post-operative treatment. So that means your compression. You have to wear that faja, for the first 6 weeks, night and day, and then after that, an additional 6 weeks, 12 hours a day. And like what I said before, you have to do your massages. You're gonna need a minimum of 20, no less than 20. Some patients might need more. I've had patients that had 30, 35 massages. You need what you need. Everybody's different, okay? So you have to think about that, and you have to save for that. Make sure you have enough, money to invest in yourself in terms of massages after surgery, because it is extremely important. But those are the things that are gonna allow you to heal well, to optimize your results, and to prevent issues with, lymphatic drainage after the massage.
Do you recommend doing a tummy tuck with liposuction and a small BBL?
So I do not combine the tummy tuck and the BBL. Whether it's a quote unquote small BBL or a regular BBL, okay? I don't like to combine those procedures. I know there's other surgeons that do, but I don't recommend it. I think there's multiple reasons for that. Most importantly is your safety. As you know, here at Pure Plastic Surgery, your safety is your number one priority. And so I don't like to combine procedures that are going to increase your risk significantly. And when you put those two procedures together, your risk for potentially dangerous stuff goes up, such as what we call a pulmonary embolism. That's when you have a blood clot that travels to the lungs, which can be very, very dangerous. It could put you in the hospital, or worse, potentially even death. So that's one thing. The risk also goes up for infection, for the need for blood transfusions, for the risk of skin dying, or what we call skin necrosis or ischemia, and also the risk for wounds opening up. On top of that, you can't recover easily because you're supposed to be on your belly for a BBL, you're supposed to be on your back for a tummy tuck. So what do? Well, you end up being on your back, and so then you end up compromising your BBL results. So now you're getting a lesser result with a higher risk. Like who would want that? Why are you gonna want a lesser result with higher risk? That makes no sense. And then on top of that, here in Florida, we got these rules where if you're doing a tummy tuck, you can only remove 1,000 cc's via liposuction. And most patients honestly need a lot more than 1,000 cc's removed, and also a lot more than 500 cc's per side placed. So now you're gonna have lesser results with a higher risk. Makes no sense. So I rather separate the procedures. I always recommend do your tummy tuck first, and then come back and do your BBL.
At 6 weeks after a BBL, does it hurt when you sit on your butt?
So some people might describe it as pain, but it's not really painful. It's just it feels very odd. It feels weird, right? Because you've been off the butt for 6 weeks. Of course, you've had the fat transfer there. You're still going to have some degree of swelling, so it's just going to feel a bit odd. It's going to feel uncomfortable. You're probably not going to want to sit, that very first day for an extended period of time. But as you continue to sit, as you gradually sit more and more, as you become more active, start doing squats, go ahead and back to the gym, things are going to normalize, things are going to soften up, and everything's going to feel all normal once again.
Okay. I will lose my BBL after pregnancy?
So for most patients, no. Actually, most patients are able to keep their BBL, not only keep their BBL, but keep their kind of new shape after pregnancy, as long as you have what I would call a healthy pregnancy. Meaning, yes, you are going to gain some weight, but only the necessary weight that you need for the pregnancy. You're not going to go crazy overboard, right? You're not going to be like, oh, I'm pregnant, and just eat everything and gain, 40, 50, 60, whatever plus pounds, right? So you want to maintain, you gain just the amount of weight that you need for the pregnancy, and you continue to be active during the pregnancy. So you continue to do your walking, going to the gym, staying active throughout your pregnancy. So if you're able to do those two things, once you've had the baby, and everything should kind of really bounce back into place. So what are the things that can change though? Well, potentially, the skin might get stretched out, so you may have more stretch marks or loose skin. And of course, the muscles might separate or become weakened. So it is possible though that you still might need a tummy tuck after your pregnancy, but not necessarily another BBL.
Does your Lipo 360 include the entire back as well?
Yeah, pretty much the entire back. I would say about 90% of the back. The only part that it doesn't include is what we call the buffalo hump, which is up here, which is kind of that transition between the lower neck and the upper back. If you do have a buffalo hump, that can be done at the time of the Lipo 360 or BBL, but it is considered an additional or add-on area.
Okay. After Lipo 360, how long is the recovery and how many days should I take off work?
So recovery after Lipo 360, if you're talking about total recovery, it's going to be 6 weeks, right? That means 6 weeks of no heavy lifting or strenuous activity. All right, having said that, when can you start driving? When can you get back to an office type setting? So usually most patients are able to get back to driving in the office in about 1 week, which is not too bad, maybe a week and a half, okay? However, if you have a job that it requires, heavy lifting or strenuous activity, for example, you're a firefighter, you're a police, you're a nurse, then sometimes these types of jobs may require the full 6 weeks. All right?
Well, a lot of questions about pricing, consultations. So let's wrap it all.
We're gonna wrap it up.
Yes,
okay.
Doc.
All right. It's been 25 minutes already.
Yes.
My lord, that was quick. All right. So, for all those questions, we're just gonna wrap it up here. Let's see. Yeah, we'll put that right here. All right. So, remember, we do several types of consultations here. So you can have what's called a virtual consult, a video consult, or an in-house consult. Okay. So if you are outside of Miami, so you're for either Florida, far away, different state, different country, then what we recommend for sure is definitely starting off with that virtual consult. And in order to do that, you go to our website, www.puroplasticsurgery.com. In there, you're going to find a little thing, a little box where it says, start your journey or book your consultation, or you can even go to the page of the site where it says virtual consultation. In there, you can fill out the questionnaire, send in your photos, that'll come directly to us. All the surgeons will be able to evaluate your questionnaire and photos. We'll make our recommendations, and then you'll get in touch with our patient care coordinator who will go over all that information for you. Okay? That's the virtual consult. And then if you want to do a video consult after that, just ask your patient care coordinator to set up the video consult, and we can do that as well. That is going to have a charge. So the virtual consult is free or zero cost. The video consult is $250. And then if you want an in-person consult, meaning you come in-house, spend some time with me here, that is also possible. That does have a charge of $500, okay? The good news is that those charges will go towards your procedure if and when you book, meaning that you're not losing that money as it goes towards the procedure, okay? But the easiest way to get in touch with us, like I said, go to our website, go to, send in your information, your contact information, fill out that virtual consultation form. And you can always call us as well at 305-230-4326. Okay? All right, everybody. Well, it's great to be back. I missed you guys. I hope you missed me. But I look forward to seeing you all next week on Hump Day with Dr. Alex Earle. I'll see you then. Take care. Ciao.
Great.